Pet medical questions answered live.
Dr. Carrie Donahue from Circle Holistic Veterinary Care is with us today, and she has Poppy.
Her personal pet?
Hi, Dr. Donahue. Good to see you.
Oh, it's great to see you guys, too.
You're looking good. So let's get to the calls. We'll start with Julie from Madison. Hi, Julie.
Hi there.
Hi, what's your question?
Well, I have a question about the use of tea tree oil. It's used a lot of times, I've seen now, for skin problems in dogs and other pets. And then again, I've heard of some really bad side effects from it, too. So that's my concern.
Okay.
Yeah, I know, and it is good to be concerned, and I kind of say that across the board with essential oils in general, because they're so powerful, and some of them can be toxic to animals if they lick them or if they ingest them. So I usually recommend staying away from tea tree oil for that reason. It's especially toxic to cats, but certainly dogs can, if they can lick it off themselves, they can get sick from it. So I usually stay away from tea tree oil for pets.
Okay, good
All
advice.
right, let's go to Tina in Wanakee. Hi, Tina. What's your question?
Hi, I'm a CNA that works at a nursing home, and so far we don't have any positive coronas, but we still have those that are being tested. And I was wondering how I could prevent any of this getting home to my cats, because I got 2 cats. And I know that, there have been cats and a dog that have tested positive for this.
Right. Yeah. This is something, and we're finding out more information on a daily basis about COVID-19 and especially how it relates to our domesticated animals. Because there have been a very few cases of a dog in the United States and the cats that have tested positive. The good news is animals and our pets don't seem to be as affected by it as people, so they're considered dead-end hosts. They can show some upper respiratory signs or GI tract issues, but it's certainly not a severe disease. It's certainly not fatal for animals, and it's not something that they, as far as we know, that they can transmit back to humans. So I usually recommend the biggest thing to do is if your animal is acting sick, talk to your veterinarian, and figure out what diagnostics need to be done to get them, feeling better, and if that testing is something that would be considered. But really right now, the numbers are so low that we're seeing in animals that, kind of the basic precautions we're all following would be the best thing to do.
Yeah, millions and millions of dogs and cats, like 2 or 3 cases. It's a lot of questions still. All right, let's go to Sherry in New Glarus. Hi, Sherry.
Hi. I have a question. I have a 10-year-old female schnauzer that's purebred, and we can't keep her from getting ear infections. I go at least 5-6 times in a year to get medicine for her, and we try trimming. They pull it out at her groomer, and it just comes back sicker than ever.
Are you doing anything just kind of prophylactically, like doing an ear wash once a week, something like that?
Yes.
Okay. So that's a good thing to do. But, really even kind of looking into what might be the underlying cause for those frequent ear infections. Sometimes a food allergy can do it. A lot of dogs are sensitive to corn and wheat, and if you can take those out of the diet, the ear infections get a lot better. Even allergies can be an underlying cause. So maybe, and, even some endocrine issues like thyroid disease or adrenal gland disease. So maybe doing some more testing if you haven't for some of those other possibilities, and then doing the weekly ear washes is a really good idea to do too.
All right, good luck to you. Let's go to David in Madison. Hi, David. What's your question?
Hi, I have a mixed breed dog. It's 3 years old, and it does a lot of random scratching. It will scratch at the sofa, on floors, any random surface you can think of. It just scratches at it, and I don't understand why.
He scratches himself on the surfaces?
No, I think he scratches the surfaces.
It scratches the surface.
He scratches the surface. Okay.
Like he's digging.
Okay. Oh, yeah.
Sort of like it's digging. Like it wants, like at a door, like it may want out, but like at the sofa, I don't understand that.
Okay.
Yeah, you know, getting into the minds of these animals is sometimes a challenge, and it might be a behavioral issue. It might be something like anxiety, and that's the reason why your dog is doing that. So, you know, it might be sort of like a compulsive disorder as well. And there are medications that are available for things like that. And maybe talking to your veterinarian about, you know, maybe some behavioral modification training or medications or even supplements that might just kind of help to calm them and might help with that behavior.
All right. Yeah, there could be something else going on there. Lots of good questions as usual. We're out of time. Thank you all for calling in. We'll do this again in a month.
Thank you, Poppy. Oh, there she goes. She finally got it.
And Carrie, too.
Yeah, Carrie, great to see you.
Oh, you too.
Take care.
Bye.
Be well. We'll have a final check of your forecast coming up.